cardiovascular disease is a disease process in our body that affects the heart and the vessels in the body. And so plaque can get built up in the body. There's all different kinds of things that can cause a person to start having the plaque being built up, and different clotting things in the body that can make cardiovascular disease come on, and it can start at a very young age. A lot of people think that cardiovascular disease just begins when someone is older, but we are seeing people younger and younger having cardiovascular disease, and there's so many things that can lead up to that, and so prevention is so important with cardiovascular disease. In cardiovascular disease, people have cardiovascular disease that might never have a heart attack, and then there's people who have cardiovascular disease that can progress to, you hear about mild heart attacks and you hear about major heart attacks, and it can progress to one of those things. You want to catch it early. So you want to know your risk factors, and your risk factors can be age, your gender, your heredity, who your parents are, and your grandparents. If they have a risk, if they had cardiovascular disease, your risk for cardiovascular disease is greater. The controllable risk factors are smoking, diet, getting enough exercise, excessive alcohol use, things like that are things that you can actually control. Making sure your blood sugar is under control if you have diabetes, making sure your blood pressure is under control, either by medicine or weight loss, and helping control that. And then high cholesterol can also cause and end cardiovascular disease. So all of those things, just keeping those things under control, the ones that we can control, and then knowing if as we get older, of course, our risk increases. And then if your parents or grandparents have a history of that, knowing that, and being aware and taking as many preventative steps as you can to prevent the disease from ever happening. Good. In prevention, you want to have those yearly appointments with your physician, going and seeing them, making sure that you go and are healthy, and if there's anything that they detect while they're there or anything that they suggest you do, that you really do those things. If they say you need to exercise, exercise. If they put you on medications, take those medications as prescribed. Don't stop them just because your blood pressure gets better. It's probably because you're on medication. So we want to continue those things and make sure that you're getting testing done, that and making sure that your doctor knows that if you have a history of it in your family, they might do further testing to see if you might have some. And also with prevention, preventing a major heart attack, if you're having chest pain, shortness of breath, getting increasingly tired, there's a bunch of different things that can be precursors to a heart attack. And so getting in with your doctor, telling them about those things so that they can do a stress test or different things to prevent the major heart attack from happening. You're getting your preventative maintenance. You're going every year to your doctor, and then there are some things that you want to go straight to the emergency room for. You're going to want to call 911 if these things happen. Chest pain. For women, a lot of times they don't have chest pain, they just have pain in their back. Some men don't have chest pain either. So some other things you might look out for: shortness of breath, getting progressively tired. Some people get really bad indigestion when that happens. Upper abdominal pain. There's many different symptoms. So those symptoms as well as others, and I really encourage you to know all of the signs and symptoms of a heart attack, not just chest pain. You can find those at hendrick.org. If you go to that website, there's an interactive a website linked to that you can go and look up all the signs and symptoms of a heart attack. So please do that and know those. If any of those signs and symptoms happen, you must call 911. It's so important not to drive yourself to the emergency room. Patients that have come in by ambulance have such better outcomes than patients that drive themselves. Things can happen. Your heart is very unstable when you're having a heart attack. You can go into a bad rhythm, or your heart can even stop. And if you're driving yourself, or even if you're driving your family member to the hospital if they're having problems, you can't do CPR on someone that's sitting in your passenger seat. So if you're in the back of an ambulance, they can do CPR, they can give you medications that can save your life. So it's so important to come by ambulance, even if you're very close to the hospital. That's such an important thing, to come by ambulance and do not drive yourself. Here at Hendrick, we are a chest pain accredited center through the Society of Cardiovascular Patient Care. We have gone through a rigorous process in getting certified or accredited through that process. We send them all of our paperwork and order sets and everything that we use in the hospital to take care of patients that come in with early heart attack signs and symptoms or having a heart attack. We send those to them, they evaluate those, and then they come to our facility and go through all of our processes here at our facility and stay and go through from the time the patient gets on the ambulance to the time that they leave the hospital, ensuring that our care is the best care possible and that we're using evidence-based practices here at Hendrick. And so going through that process, we achieve that accreditation by going above and beyond for those heart attack patients and early heart attack patients. Here at Hendrick Medical Center, we are committed to providing wonderful quality health care to our community and want people of every background to be able to get care no matter what. And so we provide a free screening event called Day to Take Heart. It's going to be on February the 6th from 4 to 7 in the Shelton building. It's on the northeast corner of the hospital. We provide different cardiac screenings that day, and we will also have a speaker that talks about cardiac related events and what to do if you're having a heart attack, those types of things. So we're very excited about this. We want to provide this to the public because we feel that everyone needs to have these screenings, and we don't want someone not to be able to have them just because of a monetary issue. We want everyone to be able to come in and have these done.